Welcome to this deep dive. We're your shortcut to understanding the big shifts happening around us.
That's right.
And today, we're really zeroing in on healthcare, specifically strategic planning and quality management.
Two sides of the same coin, really.
Exactly. We want to cut through the noise, pull out the essential insights from recent research, management thinking, that sort of thing.
Yeah, forget wading through endless reports. We're pulling out what you actually need to know.
Our mission, if you will, is to show how these two areas, strategy and quality, are totally intertwined, especially now. You can't really succeed with one without the other.
Absolutely. It's fascinating when you look closely. You see a great strategy just falls apart without real quality on the ground.
Yeah.
And, quality efforts without a clear strategic direction, they just become scattered, less effective.
Right.
The sources we looked at, like Zuckerman's latest updates, articles from the Journal of Healthcare Management, Health Affairs, they all point this way. Strong integration is key.
Okay, so let's unpack that. Where do we start? Maybe with leadership.
Good place to start, because managers are absolutely central here.
They're not just like keeping the trains running on time.
Not at all. They're the ones who have to translate the big strategic picture into actual quality improvements, day in, day out.
And there's solid data on this, isn't there? I remember seeing something.
There is a 2024 study, Smith and colleagues, I think. They found that when leaders really engage with quality initiatives, organizational performance jumps by 28%.
Wow, 28%. That's substantial.
It really is. And it shows quality isn't just some department's job, right?
It has to be embedded.
Exactly. It's woven into everything leadership does. Think about it, recruiting the right people, making sure they stay.
That directly impacts care.
Of course. And setting up safe work environments, being really clear about expectations, tracking performance.
Making sure everyone's pulling in the same direction.
Precisely. Aligning all the different departments towards those shared quality goals, that's the leadership challenge.
And leadership itself is changing, isn't it? The styles, the focus.
Yeah. The material we reviewed really digs into that. Things like transformational leadership, and especially emotional intelligence.
Emotional intelligence. That seems to be everywhere now. There was that Harvard Business Review piece, Jones and Carter, 2025.
That's the one. It highlights how leaders who get the emotional side their own, their teams build much stronger, more resilient teams.
Which you can see translating directly to patient care, better experiences.
Definitely. Transformational leaders, they inspire people, they encourage new ideas, they help teams navigate all the complexity in healthcare today.
And the emotional intelligence part, how does that play in specifically?
Well, it's about understanding yourself, managing your reactions, but also tuning into others, responding effectively.
So better communication, collaboration.
Exactly. It shapes the whole atmosphere, the culture, and that has a huge, maybe underestimated impact on delivering high-quality care consistently.
So it really makes you think, doesn't it?
Yeah.
How do managers balance that? The daily fires versus the long-term strategic thinking needed for quality.
That's the million-dollar question.
And what specific traits, really make a leader effective in building that kind of quality-first culture? Something for you, the listener, to mull over, perhaps.
Definitely worth considering.
Okay, let's pivot. Let's talk money. Because quality, or the lack of it, has major financial implications.
Oh, absolutely. The cost of quality, or COQ.
Right. Explain that a bit.
Well, it's basically three buckets. Costs to prevent problems training, good processes, costs to appraise quality audits, checks, and then
the big one.
The failure costs, when things go wrong, rework, readmissions, errors, harm.
And the cost of poor quality. It's huge, right?
Yeah.
I saw a number, $150 billion annually.
Yeah, the 2024 HFMA report estimated that for U.S. hospitals, it's staggering. It really frames why investing in quality isn't just nice to have.
It's an economic necessity.
Absolutely. And that cost of poor quality, the COPQ, it includes the obvious things like malpractice suits, but also the intangible stuff. Lost trust, damaged reputation. That's hard to measure, but incredibly costly. But the flip side is, good quality programs can actually reduce those costs.
Significantly. Studies suggest maybe a 15% reduction in COPQ is possible with strong programs. Investing in prevention pays off by cutting down those failure costs later.
There was a good example of that, wasn't there? The EHR checks?
Right, from Health Affairs in 2025, they showed implementing really thorough quality checks in the electronic health record system led to a 40% drop in medication errors.
40%. So that initial time and effort to set it up
paid off big time in the long run, both financially and obviously for patient safety.
So what are the main strategies then for managing these costs, optimizing them?
Well, first, as we said, invest in prevention. It's usually cheaper.
Okay.
Second, use data analytics. Really pinpoint where poor quality is costing you the most so you can target your efforts.
Makes sense.
And third, align everything with value-based care. If you
Yeah.
improve quality in ways the payment models reward, it creates a positive cycle.
Right. Quality improvement actually boosts revenue in that model.
But how do you make that case? Investing now for future savings. Sometimes that's a hard sell.
It can be.
What metrics really work? How do you demonstrate that ROI convincingly, especially when the benefits aren't immediate? Another tough question for our listeners.
A critical one for
All
sure.
right, let's shift gears again. Strategic planning itself. Let's break that down. What is it really at its core?
Zuckerman's 2023 work frames it nicely. It's essentially the process an organization uses to figure out how to get from where it is now
Okay.
to where it wants to be in the future, its desired state.
It's not just writing a document that sits on a shelf.
Definitely not. It's supposed to be a dynamic, ongoing process. It starts with clarifying the vision, the big dream, and the mission, the purpose.
The why.
Right. Then you need a really honest look around. Environmental analysis.
What's happening outside? Regulations, competitors, market trends.
Exactly. And also inside. What are our strengths, our weaknesses, resources, capabilities?
Got it.
That analysis then feeds into setting concrete goals, specific, measurable things you want to achieve.
Smart goals.
Usually, yes. And finally, you develop the strategies to reach those goals and figure out how you'll progress your KPIs, key performance indicators, implementation and evaluation.
And this whole process is obviously shaped by what's happening in healthcare right now.
Hugely. Patient-centered care is a massive driver. It changes how you plan.
The focus shifts.
Completely. And then there's digital transformation. Telehealth, AI, it's unavoidable.
That NEJM Catalyst study, 65% of organizations prioritizing digital integration.
Yeah, Patel et al., 2025. That shows you how central technology has become to strategy.
So how does healthcare strategic planning have to be different? Because it is healthcare. With patients, the complexity.
It has to embed that patient perspective deeply, and it needs to be incredibly adaptive because the landscape changes so fast.
And what about tech? Beyond telehealth and AI, what else should organizations be looking at for their long-term plans? What's on the horizon?
Good question. Things like remote patient monitoring, more sophisticated predictive analytics, maybe even blockchain for data security. Lots to consider.
Okay, so we've got leadership, finance, the planning process itself. Now, how do we tie it all together? Is there a framework?
Yes, the materials suggest a practical sort of 5-stage framework. Assess, identify, align, develop, and monitor.
Okay, walk us through that. Assess.
Assess is taking stock. Where are we right now? Internally, externally? What's the current reality?
Then identify.
Based on that assessment, identify the key strategic priorities. What really matters? What do we need to focus on? SWOT analysis often fits here.
Right. Strengths, weaknesses, opportunities, threats. Then align.
Crucial step. Make sure those priorities actually fit with the organization's core mission and vision. Are we chasing the right things? Or getting distracted?
Okay, develop.
This is where you create the actual action plans, the specific goals, the strategies, the tactics to achieve them, getting down to the how. Keep track, continuously measure progress against your KPIs. Are we doing what we said we'd do? Is it working? And adjust as needed. It's a cycle.
That makes sense. And using that framework, there are some really pointed questions organizations need to ask themselves now in 2025.
Definitely. Like, how well are we truly aligning with value-based care? It's not just a buzzword anymore.
Right. What do we really want to achieve with telehealth or AI in the next, say, 3-4 years? Be specific.
How can technology help us across the board, not just in pockets? What are the real risks and rewards of trying new care models?
And crucially, how do we measure success? Beyond just the bottom line, patient outcomes, quality improvements.
Those are the core questions. And remember that stakeholder point from Guren and Kim's research.
Yes, engaging everyone.
Crucial. It can't just be a top-down exercise. You need buy-in from clinicians, staff, administrators, the board. Everyone needs to feel involved.
Which leads to the question, how do you really get everyone on the same page with these big strategic goals?
Yeah.
Especially in a complex hospital system.
It takes deliberate effort, communication, showing how it connects to their work.
And what are the big risks to watch out for when you do try something new, a new model? Things that need careful thought beforehand.
Financial viability, regulatory hurdles, staff readiness, patient acceptance. Lots to consider.
Let's talk about Zuckerman's imperatives again. These must-haves for success today.
Right. His updated list for staying competitive. 5 key things.
Lay them out for us.
Okay. 1, scale and scope. Getting bigger, often through mergers or alliances, to expand reach and maybe gain efficiency.
We're seeing a lot of that McKinsey prediction about hospital mergers.
Exactly. 2, cost competitiveness. Delivering the best possible value, quality, and service for the cost. Super important with value-based care dominating now.
That's CMS data. 60% value-based payments now.
Yeah, it's the majority. 3, demonstrated quality. You have to show you're improving outcomes, reducing errors. It's tied to payments, too.
Quality metrics influencing 75% of Medicare reimbursement. That's huge.
It is. 4, exceptional service. The patient experience matters. High satisfaction links to loyalty, like that Davis and White study showed.
A 20% increase in loyalty. Wow.
And 5, service integration. Making care seamless for the patient, connecting the dots across different settings, often using EHRs and coordination.
Okay, 5 big imperatives. Scale, cost, quality, service integration. If you had to pick one as the most critical right now, what would it be and why?
That's tough. They're all linked. But I might lean towards demonstrated quality
Why that one?
because it hits patient well-being directly, and it's increasingly tied to financial survival through value-based care. It feels foundational.
Interesting. So following on that, how do smaller players compete? If scale is an imperative, what do independent hospitals or clinics do?
They probably need to be smart about it. Maybe focus on niche services, build really strong community ties, use technology cleverly for service and engagement, find their unique value proposition.
Makes sense. They can't necessarily compete on sheer size.
Right. They have to compete differently.
Okay, to make all these strategic decisions, you need good information, good tools. What does the research point to? Forecasting.
Yes, different types. Qualitative using expert judgment, especially for new things. Time series looking at past data patterns to predict the future, like patient volumes. And causal models trying to figure out the why behind trends, the relationships between variables.
Which types are most useful in healthcare?
They all have their place. Qualitative for big shifts, time series for operational planning, causal for understanding impact. And AI is making these forecasts potentially much more accurate now.
That MIT Sloan review piece suggested AI could boost accuracy by 35%.
Something like that, yeah. Significant potential there.
What about making choices when you have multiple options? How do you prioritize?
That's where prioritization frameworks come in. The materials mention the analytic hierarchy process, AHP.
AHP. Sounds complex.
It's structured, definitely. It helps you break down a decision, weigh different factors, compare options more objectively, avoids just going with gut feel.
So it brings some rigor to those tough choices.
Exactly. Helps align people, too.
And then there's predictive analytics, using data to foresee problems or opportunities.
Huge potential here. Identifying patients at high risk for readmission, for example. Optimizing staffing, forecasting costs.
That Nature Medicine study showing predictive analytics could cut readmissions by 25%.
Right. Using machine learning, EHR data, dashboards. The tools are getting powerful.
But there are ethical questions too, right? Bias in algorithms, privacy.
Absolutely critical considerations. You need strong governance around how these tools are used.
So the big questions here are, how do you actually use predictive analytics ethically and effectively day to day?
Yeah.
And what are the limits? You can't predict everything in healthcare, can you? Where are the pitfalls of relying too much on the forecasts?
Important caveats. Models are only as good as the data and assumptions, and healthcare always has uncertainties.
Okay, let's bring it together. Implementing the strategic planning process in a healthcare setting, updated for today. What are the steps?
It generally starts with that deep dive into the outside world, the external analysis. PESTLE is a common tool here. Political, economic, social, tech, legal, environmental factors.
Got it. Then look inside.
Right, the internal analysis, resources, capabilities, performance, and critically, including employee feedback, like Gallup highlighted, get insights from the front lines.
Then synthesize that into a SWOT.
Exactly. Strengths, weaknesses, opportunities, threats. Gives you a clear picture.
Next.
Alignment. Making absolutely sure your strategic direction fits your mission and values. Maybe using tools like value stream mapping to see how processes support goals.
Then setting the actual goals.
Yep. SMART goal specific, measurable, achievable, relevant, time-bound. Make them concrete.
And finally, keeping track.
Monitoring. Using those KPIs, having regular reviews, maybe quarterly, as one study suggested, to see what's working, what's not, and adjusting the plan. It's iterative.
That iterative part seems key in healthcare. So how often should organizations really revisit the whole plan? Annually, more often.
Annually for a deep review seems common best practice, but with ongoing monitoring and environmental scanning much more frequently, you need to stay nimble.
And for that initial external analysis, any specific tools or techniques to make it really robust, beyond just PESTLE?
Things like competitive intelligence gathering, scenario planning, attending industry events, talking to experts, really trying to anticipate shifts.
Okay, wrapping up, let's circle back one last time to leadership's role in quality.
It really can't be overstated. It's an ongoing commitment, not a one-off project.
That BMJ quality and safety study showing a 30% improvement with leader involvement.
Exactly. Leaders have to actively champion quality, provide resources, build that culture. Just talking about it isn't enough.
And making sure the quality plan actually supports the strategic plan.
Absolutely critical. They can't be separate streams. Quality efforts need to directly advance strategic goals. Otherwise, it's wasted effort.
And quality leaders have specific roles too, consulting, facilitating.
Yes, they need to educate everyone on their role in quality. And they need to be the bridge between the data and leadership, helping make informed decisions. Using tools like the PDSA cycle plan, do, study, act, to test changes systematically.
So, final thoughts for our listeners. How can quality leaders effectively get buy-in, especially from people resistant to change? What strategies work?
Showing the why is key. Connecting quality improvements to better patient outcomes, yes, but also to making staff jobs easier, reducing rework, and achieving strategic goals. Involving them in the process helps too.
And what metrics really resonate with senior leadership? How do you best communicate the value of quality in their language?
Focus on metrics linked to strategic priorities and financials. Risk-adjusted outcomes, patient satisfaction scores tied to loyalty, cost per episode, reduction in specific high-cost complications, things that clearly show impact on the bottom line and strategic aims.
This has been incredibly insightful. We've really dug into how strategic planning and quality management are, well, inseparable for healthcare success today,
They really are. Two engines driving the same vehicle.
and the importance of using data, using tools like predictive analytics, but always grounded in strong leadership commitment.
Couldn't agree more. It's about being intentional, data-informed, and adaptable.
So here's a final thought to leave you with. We've talked a lot about quality as it is now, but with medical tech advancing so fast and patient expectations always changing,
Hmm.
how might the very definition of quality in healthcare change in the coming years? What could it look like, and what would that mean for strategic planning down the road?
That's a big question. Definitely something to ponder.
Something to think about. We hope you'll continue exploring these topics. Thanks for joining us for this deep dive.